The next paper on use of artificial intelligence in mental health was written by Sandy Sanbar, my predecessor as the chair of the Board of Legal Medicine, a past president of the American College of Legal Medicine, someone I've known for 40 years, in fact, 37 years ago when he was president of the college. He suggested a paper in the fall seminar to Dale Cowan and myself, and we did a seminar on human organ transplantation, got a book out of it, and just about that time, Sandy began organizing this seminar, which he has done every year now for 37 years. Sandy's got an incredible list of accomplishments. He was born in Haifa, Israel. He graduated from medical school at the American University in Lebanon. He came to the United States, earned a PhD and an MD from the University of Oklahoma. Did his cardiology fellowship at University of Oklahoma. And unfortunately, this year he is too ill to be here with us physically, but he is online, and I think maybe he'd be willing to answer some questions. And we are very fortunate in having with us today Sandy's daughter, Suzanne Bushauer. And she is going to read the paper. And after the paper, I'm actually going to introduce her because she's going to be presenting her own paper. And I should mention also that Tyler, Sandy's grandson, who has been up here keeping all our slides together, he was instrumental in putting this paper together. So, Suzanne?
All right, can everyone hear me? Ladies and gentlemen, there is a shortage of mental health professionals in the United States. Oh, did I turn this on?
Yeah, I'm just a little low, so just talking to the mic.
Oh, okay. Here we go. There is a shortage of mental health professionals in the United States. In 2022, the American oops. There is a shortage of mental health professionals in the United States. In 2022, the American Psychological Association stated that demand for mental health services continues to increase while psychologists are struggling to provide needed care. In 2023, according to the DHS, the psychiatric workforce, which is about 45,580, has a shortage of 6%. In 2024, the shortage will be 9%, and it will reach 12% by 2025. In December of 2022, Congress passed the Mental Health Access Improvement Act, which was signed into law by President Biden. This bill will allow licensed professional counselors and marriage family therapists to enroll as providers with Medicare. As of January 1st, 2024, licensed professional counselors and marriage family therapists will be able to bill Medicare Part B and be reimbursed for approved services. Another approach to meet this shortage is artificial intelligence. which may provide new tools to assist mental health professionals and decrease their burden. This slide lists many artificial intelligence technologies that are used in the mental health field. Mental health chatbots, detection of diagnosis of mental health conditions, large language model, and others. The strength of traditional mental health therapy lies in the human connection, the empathetic understanding, the nuances in human emotions, relationships, and the personalized feedback is irreplaceable. But traditional therapy often requires appointments and can sometimes be geographically and financially prohibitive. The human therapists can vary in their approaches and techniques. In contrast, artificial intelligence-driven therapy can simulate conversations, but the genuine human empathy is still out of its reach. But artificial intelligence-driven therapy, being digital, offers 24/7 support, which breaks barriers of time and location. Artificial intelligence-driven therapy provides consistent, data-driven feedback and intervention. Keep in mind that presently, artificial intelligence lacks the important traits of human imagination, insight, and empathy. This slide shows a few examples of symptom checkers or medical diagnosis apps. They utilize AI-based healthcare apps. They are designed to improve and streamline tasks, thereby enabling doctors to work more efficiently. They are used by patients before seeing a doctor, online at some major hospitals and doctors' offices. Mental health chatbots and robots are AI tools and differ from symptoms checkers. They are designed to be used in non-emergency situations. They are not meant for a mental health crisis. A patient who is going through serious depressive episodes needs immediate help. They should seek advice from mental health professionals straight away instead of using an app. Mental health chatbots have developed over the past 73 years, as noted on this timeline. On this slide, presently, there are numerous chatbots, and they are in use in every field of medicine. In the 1960s, Dr. Joseph Weizenbaum, a computer scientist at MIT, created a computer program called ELIZA. It was named after Eliza Doolittle, the heroine of George Bernard Shaw's Pygmalion. In 1956, the musical My Fair Lady, which was adopted from the novel Pygmalion, was first staged in Broadway and ran successfully for 6 years. In 1966, Dr. Weizenbaum's ELIZA made history by becoming the first ever chatbot. ELIZA did not have memory and no processing power, but it created a therapeutic illusion. It was designed to simulate Rogerian therapy, in which the patient directs the conversation and the therapist repeats what the patient says. For example, the user says, "My boyfriend made me come here." ELIZA says, "Your boyfriend made you come here?" The user says, "Yes, he says I'm depressed much of the time." ELIZA, "I'm sorry to hear that you are depressed." User, "Yes, I am unhappy." ELIZA, "Do you think coming here will help you not to be unhappy?" Many people who tried the program found it useful and captivating. His own secretary asked him to leave the room so that she could spend time alone with ELIZA. Doctors saw it as a potentially transformative tool. Several hundred patients an hour could be handled by a computer system. In 1966, 3 psychiatrists wrote in the Journal of Nervous and Mental Disease, "The human therapists involved in the design and operation of this system, ELIZA, would not be replaced, but would become much more efficient doctors, since their efforts would no longer be limited to a 1-to-1 patient-therapist ratio as now exists." In 1972, another program named Perry was written by psychiatrist Kenneth Colby, then at Stanford University. Unlike ELIZA, Perry attempted to simulate a person with paranoid schizophrenia. Psychiatrists who were given transcripts of a therapy session often couldn't tell the difference between Perry and humans. In 1972, Perry and Eliza met up for a therapy session. Perry said, "Do you know anything about bookies?" Eliza, "What makes you think I know anything about bookies?" Perry, "A bookie didn't pay me off once." Eliza, "What does that suggest to you?" Perry, "I beat up the bookie who did not pay off, and I thought he might use his friends in the underworld to get even with me." In 2017, Allison Darcy, a clinical research psychologist at Stanford, founded Wobot, which is an automated mental health support through a smartphone app. Its approach is based on cognitive behavioral therapy. In 2018, Wiza was another popular mental health chatbot which offers users emotional support. It uses evidence-based therapeutic techniques such as cognitive behavioral therapy. Chatbots have advanced to human figures as noted on this slide. There are also fully developed humanoids that walk and talk like humans. The medical and mental health chatbots are tools that augment doctors' intelligence. Their use has become increasingly popular. Some patients prefer to interact with chatbots rather than human therapists because there's less stigma involved in asking for help. The benefits of chatbots are availability around the clock. Chatbots provide critical information instantly. They provide personalized care, collect data for future reference, improve patient engagement. They are cost-effective, reduce wait times for patients and providers, improve accuracy and consistency in healthcare work. The following slides present some pearls about the use of AI in mental health. Pearl 1. Besides the one-on-one in-person meeting, some psychiatrists are using AI for a variety of data sources. These include medical records, social media, and online searches, all of which aid in identifying behavioral changes indicative of mental health issues. Pearl 2. Digital psychiatrists use AI to analyze conversational language patterns and types of behaviors on smartphones in order to detect underlying conditions. By looking at speech patterns and human movements, smartphones could pick up subtle changes indicating the start of a worsening of symptoms. Wearable devices such as an AI or smartwatch may notice subtle physical changes long before patients themselves even notice problems. These devices could be bringing objective, real-time data to provide medical care. Pearl 3. AI-driven chatbots are designed to emulate human practitioners. The chatbots may recognize mental health issues sooner and recommend suitable interventions and the humans might miss. Some believe that AI-driven therapy and support systems seem to be the future of mental health. Pearl 4. AI-based interventions bridge a gap caused by therapist shortages by extending mental health care to a broader population while preserving the choice for human therapy. Pearl 5. AI-generated videos can help children with autism acquire essential skills in a controlled environment. AI has also shown promise in assisting individuals with PTSD, anxiety, and depression. Pearl 6. AI can personalize treatment regimens by suggesting non-pharmaceutical alternatives tailored to individual profiles. Pearl 7. One critical issue in mental health is predicting self-harm before it happens. Artificial intelligence has the ability to predict suicidal tendencies through data analysis. It can outperform human assessments and provide valuable data-driven insights. Pearl 8. Combining AI-generated diagnosis with those from human practitioners can result in more accurate and unbiased assessment. AI can mitigate human biases by employing impartial algorithms for diagnosis and treatment recommendations. However, the inclusion of AI-driven mental health care raises concern about the erosion of the human elements like empathy, and trust in the therapist-patient relationship. To conclude, in September 2023, Dr. Bobby Hoffman, a psychologist, titled his article with this question: "Is AI the key to improving mental health care accessibility?" He stated, "AI can improve mental health diagnosis, therapy, and treatment by increasing access and personalizing care. AI automation can help address therapist shortages, extend care to more people, and reduce costs. AI can assist people struggling with autism or PTSD while mitigating biases and enhancing mental health care." And that concludes Dr. Sanbar's presentation on artificial intelligence in the mental health care.